Well, the last time Dr. Daniel Brown was in here talking about cosmetic surgery, we were talking about the 3 most popular types of cosmetic surgeries and some of the details around that. He got so many questions, he wanted to come back on and address you directly just to answer some of those right here on San Diego Living. So, Doctor, good to see you again. How are you?
Very good to see you. Thanks for having me back on, Mark.
So here's what happened. You offered a free consultation, which you're going to offer again today, to any of our San Diego Living viewers. So a free consultation on cosmetic surgery, and then 20% off of any cosmetic surgery that you do in the office.
Yeah, you're right.
So the phones just lit up.
They really, really did. And we got so many questions about these procedures, and people just kind of wanted to know, what do I need to expect from this? You know, I had a call from a lady that works in the local aerospace industry. She'd had 3 children. She wanted to know how to plan her vacation so she could have her abdominoplasty and how long that would take. A local man working for a university said, hey, I want to plan my vacation around my liposuction. How long do I have to take off for that? Can I go on vacation afterwards and feel good?
So these are all really, really good questions. Let's kind of walk through the most popular procedures again. Breast augmentation, lipo, and tummy tuck. Well, let's talk about breast augmentation and answer some more of those questions. And again, folks, as you are developing your own questions here, remember, make an appointment with the doctor, a free consultation. Come in and see him, and keep in mind that all these procedures, any procedure you choose, 20% off.
Correct. So what people can expect is, you know, come in for that complimentary consultation. We'll sit down. I'll listen to your areas of concern, learn about what you want for your desired results. We'll do a physical exam where I'll give you my recommendations based on your very specific anatomy. Then we'll sit down together. We'll come up with a plan that really gets you the best result that you want in a safe, comfortable way possible. So, for breast augmentation, just some of the details I'd like to go through. Who's the ideal candidate? Just a woman that's unhappy with her current breast size. She's either always been too small, felt like her body was sort of out of proportion, really wanted to have fuller, more feminine breasts, or someone that's lost weight during pregnancy. And like you saw on the slide, over 350,000 per year. Many times, you know, those people they can return to work in 4 to 7 days. They can return to light exercise in a week and really back to normal activity in 3 weeks, which, you know, people don't really know that. They're expecting, oh, I'm going to have this surgery. I'm going to be out of commission for months.
And
that's just
really
not true.
The case. Liposuction, let's talk about that. Again, one of the more popular procedures.
Right. Liposuction basically is for those areas that are really resistant to diet and exercise. Local areas of fat, say in the lower abdomen or hips, which we all know, you know, those are very tough to get rid of. People need to have good skin tone and elasticity. Again, as you see on the slide, over 340,000 a year. The procedure takes perhaps 1 to 3 hours, depending on how many areas or how much you're having done. You can be back to work in 1 to 5 days, again, depending on those areas, back to exercise in 10 days, and really back to that normal activity in 3 weeks to a month.
And again, these things show results very, very quickly.
They really do. You know, people are a little bit swollen and maybe have a little bruising for a little while, but people are so happy with those results, and they can get right back out there and get back to their lives.
All right, tummy tuck. That was in our top 3 of most popular procedures.
Correct. So tummy tuck, ideal candidate, somebody that most probably has had a pregnancy or a weight loss, just has a bit of excess skin, some prominent fat, perhaps some bulging in the lower abdomen due to those weakened muscles secondary to pregnancy. That procedure takes about 3 hours. You're going to be sore for probably about a week afterwards and have to wear a bit of a support garment, but 150,000 of those in the U.S. per year, back to work in 10 to 14 days, return to exercise in 2 weeks, and really back to your normal activity in a month. And, you know, not a significant amount of time off of work. You can definitely plan your vacation around that. Make sure you have a little bit of help in the house, but most people are very comfortable even after a week.
Right. Now, a lot of folks, women who've maybe gone through pregnancy and had a C-section, and you would think, you know, after having a C-section that they would heal up well, but there's after effects sometimes from a C-section where the muscles had been cut and then not properly sewn back together again. Can you fix that with a tummy tuck?
You certainly can, and that's one of the aspects of you know, the tummy tuck that I perform really is about making sure those muscles are put back together, that you have that firm corset of your abdomen so that you can go back to working out and you have that nice flat tummy that people are really wanting, that sort of natural, youthful, rejuvenated look.
Yeah, that might be one of those cases where through no fault of the woman, she couldn't get that figure back because the muscles just wouldn't respond anymore. So you help put everything back together so they can get back in shape the way they had always planned to.
Very correct. You know, and there's no way people say, I've been exercising for years, I can't get rid of this pooch. You're not going to get rid of the pooch because those abdominal muscles are stretched out. They need to be tightened back up again.
All right, folks, 20% off of any cosmetic procedure that Dr. Brown does. Now, he'll also give you 20% off of Botox and Juvederm. That's not a surgical procedure, but that is also a bit of a small miracle, what Botox and Juvederm can do.
Right. Those are great procedures, and we talked about that before on my first segment here about, you know, you can come in over lunch or, you know, right before a big dinner out. You can have the procedure done and be back out there and look natural, look youthful, look rejuvenated, and people say, wow, you just look wonderful, and it only took 15 or 20 minutes.
Fantastic. All right, folks, free consultation if you go in and see Dr. Brown, and then 20% off of any of those procedures. So take advantage of the free consultation. Get your questions answered if we didn't answer them here today. And the number's on your screen. Dr. Brown, always good to see you.
Good to see you as well.
Come back and see us anytime.
Thanks so much. Have a good day.
You too. Okay, for more information, you go to san diego6.com and you'll find it there.